Welcome to week 2. We're going to go through our general assessment, nutrition, and culture. Making my slides working. All right. So on general survey, it sounds like a big fancy word, but this is something that you already do all the time, right? You're always gathering information when you look at a person, and whether you understand or recognize it or not, you are looking at their skin color, their positioning, the way that they're dressed, their behavior and movements, the speed of their voice. Like all of these data points are being collected by you and evaluated for kind of a general overall feeling of the person and kind of where they fit in your world. Right? So if this is a person on the bus and you see them looking suspicious and they have a hand in their jacket, you tend to be on higher alert. Like, is this someone I should be afraid of? And the same in the hospital setting, right? Or the healthcare setting. You know, you're pulling all these data points to get a feel for what you think is happening with your patient, right? So in this picture, right, what do you see? What do you chart? And so the point of this chapter and kind of fine-tuning your skills is to be able to break down all those little data points and then figure out how would you chart that, right? I feel like something's happening with this guy. There's some distress, right? And then what do you see and how do you chart? Is he pale? Is he diaphoretic? Is he, you could put in quotes. I have crushing chest pain in quotes, right? He has subjective, I have 8 out of 10 chest pain. That would be subjective finding that you would chart. Non-radiating, right, or radiating to left arm and left jaw, associated nausea, vomiting, diaphoretic. All of those pieces, kind of lend itself to what sort of state he's in and how worried you need to be about him, right? So he has grimacing, he's clutching left anterior chest, complains of 8 out of 10 radiating chest pain that started 30 minutes ago while playing basketball, right? So all those data points that you collect, and it helps you make a decision about how worried you are about your patient. And then learning to dissect those data points and chart them in an appropriate way. It's a skill, right? So level of consciousness, right? I was talking about all the data points that you collect is, are they lethargic? Are they obtunded? Are they alert and oriented? Are they responsive? Are they overly responsive, right? What's their facial expression look like? Do they have a flat affect where their face looks like a mask? It's not really moving congruently with the situation. Odors, right? Do they smell of alcohol? Right? Do they smell of urine? Do they have fruity breath? There's so much information to gather just on your own assessment information. General appearance, posture, right? Speech, anxiety, depression. You can pick up these data points, and then learning how to chart them without judgment is a skill. Right? So patient demonstrating erratic movement, pacing, wringing hands, speaking to someone who isn't present in the room, or patient states and put it in quotes, and you can actually quote if they're saying things that are disturbing or violent, because it helps paint that picture without saying patient is dangerous, right? That's a judgment, and your job is to chart your observations and your collected data to why you feel this way, right? And general dress and hygiene, right, along with odor, all those things lend itself to that clinical picture. And then here my chart is a little out of the viewfinder, but so then you have the ones that you actually measure, and these are other data points that help create the picture of how worried am I about this patient, right? So you're looking at your blood pressures. Let me adjust this screen real fast. Okay. So now you have your blood pressures, right? And palpating arteries, right? These are all data points that you doing them as one thing and charting them as another, right? So when you're charting your palpation of arteries, you'll actually chart the fortitude of the artery, the strength that you feel. 2+, right? 2+ and bilateral brachial arteries if you're doing brachial or radial, right? More vital signs, your heart rate and the rhythm itself. Is it regular, right? Regular to itself, beat, 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 beat. Or is it irregular? So you'll see irregular heartbeats with PVCs. You'll see it with younger people with sinus arrhythmia, where they take a breath and it changes the rhythm. And that's a normal finding for a young person. You'll see that with atrial fibrillation, right, where it is not regular to itself. So you don't have to know at this point, at the in-depth, we'll go into cardiac later, but simple heart rate and rhythm, right? Rate is 82 beats a minute. Rhythm is regular. Respiratory rate and rhythm, same thing. Is it regular to itself? Are they breathing in, breathing out, breathing in, breathing out? And again, little babes, it is a normal finding to have irregular respirations on a small baby and abdominal breathing. But there's other data points to collect, like if you're seeing retractions or a tracheal deviation, those things, those are signs that there's distress. And then temperature, another vital sign, right? And you have a lot of different ways to measure your temp. We tend to rely on rectal temps for our children, but axillary, you can use, especially for those patients that you can't get an oral temp or a rectal temp quickly. And then we'll do the superficial scan, or you can do an ear scan too, but they're only as reliable as the user, as we've seen, especially with this COVID pandemic, right? Where you just get the little infrared, they point at you. Now looking at this is looking at that rate of breathing, right? Where these are regular to themselves, but it's slow and deep. Bradypnea, right? Rapid, shallow breathing, tachypnea. Sighing respirations, taking a breath in, and then normal, smaller, and then and you'll see these with metabolic disorders, right? Because you're changing with gas exchange, trying to accommodate with metabolic disorder. You also see it with very sleepy people, right? Prolonged expiration. You can also see this in obstructive breathing with people who have respiratory conditions such as COPD, emphysema, chronic bronchitis, right? With an obstructive breathing problem or breathing pattern. Deep, rapid, this, like our Kussmaul, are deep, rapid breaths. You can also see it in hyperventilation, right? Slow, shallow breathing, and these are literally the fancy words to go along with the assessment itself. So you can see the ataxic or BIOTS is disorganized in that it is not regular to itself, right? And this is a dangerous one. If you're seeing this is a dangerous one. Chain stroke, same thing. Same thing. It is one that is not, it's not going in a positive direction. So you'll want to intervene. These are patients who are in distress. All right. And now my vital signs. One moment. Let me fix my screen again. Okay. And so I have pain, right, which is one of your vital signs, of course. And this is subjective. There is no right or wrong here, right? So this is the patient's stated pain. And the main ones that you're looking at, Caldera and Oldcart, are the main acronyms, right? Character, onset, location, duration, exacerbation, radiation. I can't remember them all right now. But so there are acronyms to help remember all those pieces to gather as you are assessing someone's pain, because it tells you a lot about their condition. Now, acute versus a chronic pain. Oops, I'll add an A in there for the PowerPoint. So types of pain, nociceptive versus somatic pain, right? So nociceptive is the pain related to tissue damage itself, somatic, right? Talking about the body. Neuropathic is from the nerves, right? Neuro is the nerves themselves, like your peripheral nervous system or central nervous system injury. And then psychogenic, idiopathic, meaning I don't know the cause, right? And so our body is a holistic system, right? So it is not uncommon to find increased reports of physical pain for patients that have increased stress, PTSD, mental conditions as well. And then there are sources of pain that we cannot identify. We haven't been able to identify, but it exists because it is reported by patient. This is not something that we as nurses can say, well, I don't believe that they have pain, right? This is a subjective finding. So what the patient says is what is accurate. Nutrition break, bio break, continue on. So on nutrition, when you're looking at general nutrition, you're looking at weight gain, weight loss, right? And a lot of things affect that. As you guys know, with the global pandemic, mental health absolutely affects your nutrition and weight gain and loss, right? GI, endocrine problems, thyroid issues, cardiac issues, right, can accumulate to body weight increase, but it's fluid, right? Caloric balance, and then changes in metabolism we talked about. Hydration status in general. Oh, sorry, I don't know why that popped on late. And now moving on to health history. So gathering a solid health history, talking to them about their exercise, nutrition patterns, fatigue, allergies, problems with GI system, right? If they've had a recent gastric bypass and they are struggling to stick with the demands of those smaller frequent meals, right? They can actually lose weight faster than they should be. If they have problems swallowing or chewing, right? If they're older and they haven't been able to be fitted for good dentures, you'll see weight changes that are problematic. In general survey, you're looking at all aspects, their height, their weight, their BMI, difficulties chewing or swallowing, like I was saying, and you'll see it manifested in all aspects of their system, right? Their hair, their head, eyes, ears, nose, throat, cardiovascular, GI, musculoskeletal, neuro, right? This is an image of my edema, and you can see this is for pitting edema. So when you push your finger in and it continues to have an indent where you push in, this is how you grade the 1+, 2+, 3+, 4+, when you see the pitting edema in your charting. Health promotion and differences between ages. So adolescents, childbearing, and females, they need increased iron and folic acid, right? They're building and developing, and you need to provide extra nutrition. Older adults need increase in vitamin B12 and calcium, especially for that bone density, and increased vitamin D, right? There's been a bigger push on vitamin D, especially with our senior population. And then we're moving to our cultural and spiritual. Cultural and spiritual always affects the individual, right? Having a balance between the physical, the mental, and the cultural spiritual is imperative to having good health. Cultural humility involves self-awareness, respectful communication, and collaboration with partnerships, right? The RESPECT model, and this is literally the acronym, and then of course I have a respectful baby in the corner. But always building a rapport with your patients, showing empathy and support, giving explanations, cultural competence, and trust. These are essential qualities in maintaining an open, respectful dialogue with your patients. This is a relationship, right? Spiritual distress. I don't have to read it for you, but yeah, know your spiritual distress. And then Stoll's guidelines for spiritual assessment. And everyone has, there's a whole array of spiritual beliefs and spiritual practices, right, that we as the healthcare providers should respect and support and maintain. And so having an open place to discuss that and also bring in sources of strength and spiritual or religious practice, especially when it's appropriate in the hospital setting or the healthcare setting, is essential for good nursing, right? And voila, the end of my spiritual pain nutrition. Thank you so much, and we're on to our next PowerPoint.